Dr. Amspacher joins us now with some information on breast reductions and lifts. And as we were just discussing, for a lot of people that are in need of breast reductions, it's actually a safety concern and a health concern.
Yeah, a lot of ladies come to us and they tell us that, well, I've had chronic neck and back pain for a number of years, and I've tried a lot of specialized bras, I've tried diet and exercise, and I still have a lot of neck and back pain. Now, I was wondering, could a breast reduction give me some help and relief with some of those symptoms? And I tell a lot of folks in some cases it can. It's a procedure that we do on an outpatient basis, and in some cases insurance will cover it, but it has to be followed a lot of strict criteria and guidelines that they have in order for us to apply for a patient.
And what are some kind of symptoms that people might have if they are in need of something like this?
Frequently ladies will tell me that they get bra strap grooving lines up around their shoulders, that they have chronic kind of neck aches. Some people will have migraines and headaches. In some cases it can help with those, especially if they're from the back of the neck. And neck and back pain, and they feel like they're hunched over a lot. And then they have to have a certain large volume to their breast in order to qualify for insurance purposes. And that helps out and improves a lot of ladies' quality of life. I always tell folks I don't expect to get 100% relief in their pain, but frequently we can give folks anywhere from 20 to 80% relief in a lot of their neck and back symptoms.
And what is the recovery process for going through something like this?
Generally, I tell folks you're going to need usually about a week off of work afterwards. We put you on heavy lifting restrictions for about 4 to 6 weeks after that, but most folks do real well. It's outpatient. You go home the same day. You come back to our office for a checkup the next day. And folks, I think it's one of our happiest surgeries because it makes such a quality of improvement in life, and they get a double benefit. They get the improvement in neck and back pain, and they also get a lift at the same time, which is just an improvement in tightening of the breast envelope.
And switching over kind of to the lift aspect, if you're not getting that for with the reduction, excuse me, it's more of a cosmetic surgery.
Right. Well, I have a lot of ladies that tell me, you know, time and gravity have had an effect, and they always do. And having children and nursing and all of those things can have an effect on where a breast sits. And so what happens is the nipple heads south with time. And so what we do is we have a way of restoring it to its more youthful form, putting it back up in the center of the breast, and that's called a mastopexy or breast lift. And that is a procedure that a lot of ladies like because it kind of, I like to say, restores things to their former glory. And so a lot of ladies find it a very helpful procedure to kind of put them back to a more youthful breast that they used to have.
And that is not something that insurance covers, so is that a pretty hefty price?
It's not terribly expensive compared to a lot of things, and it's definitely, they give a discount for folks that are paying out of pocket versus insurance, and so it's very reasonable, and I think that it helps a lot of folks out and improves their happiness with their appearance.
All right, and if anyone is interested, can you just remind them where you're located?
Yeah, they can get a hold of us. Our office is on the North Belt Highway across from Home Depot, but they can give us a call at 383-8180 to schedule an appointment to talk to me or my partner, Dr. Lee.
All right, well, thank you so much for joining us tonight and for those helpful tips. We're going to